Welcome back to another episode of the Diabetes Digital Podcast. Did you know that advocating for yourself in the medical system can lead to better health outcomes? In today's episode of the podcast, we're sharing practical strategies to help you feel confident and empowered when navigating healthcare. So, whether or not you're managing diabetes, or you are seeking a diagnosis, or you simply want to ensure that your concerns are heard, this episode is going to offer insights on how you can get the care you need.
Yes, and for today's episode, we're going to cover how to prepare for medical appointments, the best ways to communicate your symptoms, how to ask thoughtful questions that guide your provider in the right direction. You're also going to learn why keeping a health journal, bringing a support person, following up through patient portals, how all of that can make a really big difference in your healthcare experience. And our focus is always building strong collaborative relationships with your healthcare providers, because that's going to allow you to advocate for yourself effectively, but also have that support that you really need to make sure that you have the best health outcomes.
Welcome to the Diabetes Digital Podcast. I'm Wendy.
And I'm Jess, and we're best friends, registered dietitians, and diabetes educators.
Through our telehealth platform, diabetesdigital.co, we offer accessible and personalized virtual nutrition counseling for people with diabetes and prediabetes.
Visit diabetesdigital.co, that's C-O, to book your first appointment. We accept insurance and offer affordable self-pay options. Now, let's get into today's episode.
This podcast is brought to you by Hero Bread. As dietitians, we're always on the hunt for store-bought foods that we can confidently recommend to our patients. But here is the catch: anything we recommend has to actually taste good. Life is short, and I both live to eat and eat to live. That's when Hero Bread reached out. I'd seen them in stores, but I hadn't picked anything up yet, and they had sent a bunch of products for us to try. Now, my husband and I, we love food, and we were immediately hooked. Hero Bread isn't just tasty, it's functional too. Each serving has 0 to 2 grams of net carbs, no sugar, and 4 to 10 grams of protein depending upon the product. So the Hawaiian rolls, for example, which are new and I love, they have 4 grams of protein per serving. It's perfect for managing blood sugar or adding more protein while eating the bread you love. Their tortillas are a new favorite in my house. My husband and I both love using them to make quesadillas as quick snacks. I'm a big quesadilla girl. I've also been using their bread for sandwiches. I love making a sandwich for lunch because it's easy and it's filling, but I am picky about bread. It has to be the best part. And here's the thing: sometimes breads with health claims tend to be dry and disappointing, but not this one. Hero Bread is moist, chewy, and really, truly satisfying. Their hamburger buns are also perfect for my vegetarian patties, and the extra protein helps me hit my daily protein goals. Now, whether you're looking to manage your blood sugar or you just want to enjoy a delicious bread option with added protein and prebiotic fiber, Hero Bread is a simple and tasty option. Ready to give it a try? Visit hero.co to shop their full lineup and use our special coupon code DD10, that's DD as in Diabetes Digital 10, to get 10% off at checkout. And don't forget, they also offer free shipping for orders over $50. That's hero.co. Now, on to the episode. Before we get into some of our advice, I just want to start with a personal story. And I feel like anytime I'm on a podcast these days, I tell this story just to illustrate many different things, but that like sometimes you do have to really advocate for yourself and trust yourself in your own lived experience. So a few years ago, I had been experiencing a mix of symptoms that didn't really make any sense to me. I had extreme fatigue. I felt like no matter how much I slept, I was exhausted. Also, I didn't really sleep. Even if I slept, I was exhausted, but I didn't really sleep for like a year. It was a really challenging time. I even got like a sleep expert to kind of help me, and all the things that she recommended, I tried and nothing worked. I was also having very irregular cycles or sometimes no period at all, which was very odd for me because my cycle had always been really regular. I also had some unexplained weight changes, even though I was maintaining the same routine. And I know that we are a weight inclusive podcast. And, typically as people get older, they do end up gaining more weight. However, weight sometimes is an indicator. Like if nothing is changing and there's a significant change in your weight, it might be an indicator that something is going on, right? So I was like, something just seems a little off. Also, I was having a lot of brain fog and just like mood shifts. I remember being in meetings, I would just like start crying. Like I could not control my moods at all. And I could not get any work done. I felt like I just was not myself. I was also started having these like insane hot flashes. And I was just like, what is going on in my life? So I went to 8 doctors, unfortunately. Yeah. And probably honestly more. 8 doctors plus like this sleep specialist, plus I did acupuncture, I did chiropractic. Like I did so many different things to try to get to whatever was going on. And I told, all the doctors what I was experiencing. And I felt like there was just something off going on. But their response was usually just like, oh, you're probably just stressed. Like, just exercise more, like get some sleep. And I'm like, I'm trying to sleep. And like, I literally cannot sleep. I'm waking up in like pools of sweat every night. Like something is off. Anyways, after the 8th doctor, I finally realized what I had was a condition called primary ovarian failure, which essentially is early menopause. And your body just kind of jump starts you into menopause because your ovaries are not really functioning anymore. It can be caused by so many different things, but I think that because I have like other autoimmune conditions, I feel like it was a autoimmune type of thing where my body just started attacking my ovaries. But like once I got the treatment that I needed after the advocating for myself, like my life improved so much. Like all those things I mentioned have gotten a lot better. Not that I'm like, where I was before, but I still feel a lot better. So I'm curious, Wendy, like, have you ever experienced anything similar, or like, did you have an experience where you had to advocate for yourself in the medical system?
Yeah, I remember when you were going through that, and I was like, oh my God. It was like we were trying to get to the bottom of what was going on, and it just felt like exhausting with all it. I mean, I
Yeah.
can imagine you going through it, just like all the visits that you had to go to. And I haven't gone through anything like that myself. But I will say, like, working in healthcare for all of these years, I've seen this happen like so many times with other people. And I feel like it's affected my approach to like getting preventative care, where like I don't even have a primary care provider at this point. And I haven't in a long time. Like at one point, I was just going to urgent care because I was like, just get my labs done and I can interpret them myself, because I just didn't want to have, just that kind of interaction where I feel rushed or I feel like I'm not being listened to, because it's so common.
Mm-hmm.
And then I was like, well, I should probably get like a primary doctor. And then I don't know, I would maybe like get one and then I wouldn't go back. And so I have like a very complicated relationship with just like healthcare personally. And to this day, I still don't have a primary. I need to get one, partly because I've just been like moving a lot as well. But it's also like just my hesitation of like having to deal with going into the clinic, dealing with, staff that might not be very friendly. Just like all of those things are like they kind of push you away from like wanting to do these visits,
For sure. And I think that there are good doctors out there. And I also think when you have a good provider, you have to like affirm them. That's
Yeah.
like my biggest thing. Because the doctor who finally diagnosed me and helped me and was like, this is so obvious what you have. Her name was also Jessica. She worked at Cedars-Sinai. And I was like, oh my God, you literally like saved my life. Like, thank you so much. I'm like, you changed my life. Like, I can't believe this. And for her, it was like so basic. She's a reproductive endocrinologist. She's like, why has this taken you so long for them to give you a diagnosis? Like, this is very obvious. But yeah, I think once you have those good providers, like hold on to them. And if you have a bad provider, like Wendy said, don't just settle. Like
Yeah.
keep trying to find someone who really like gets it. And sometimes, unfortunately, it takes a lot of time. And that is a privilege too, to be able to find 8 doctors, right? Like some people don't have health insurance, or, I know even in Sacramento, there's a lot of long wait times for finding a provider. So that can be really challenging, but just don't give up. And, if you get that same advice that I was getting, where they're just like, oh, it's stress, or, oh, like you just need to focus on diet and lifestyle. And I'm like, no, something's really wrong here. I always share the story to my endocrinologist. He actually fired me as a patient, which is ironic because I don't know how I didn't fire him first. Basically, when I was going to him with these concerns, he's like, well, because I have Hashimoto's and hypothyroid, he's like, you're a dietitian. Like, I don't understand how you're gaining so much weight. He was like, you should know what to do.
Oh my God.
And I was like, okay. And honestly, I didn't even take it because I just like these days, I'm like, some people are so stuck in that mentality that it's like, whatever. But if I feel more vulnerable. Like that could be devastating to hear from somebody. But he was the only endocrinologist in that town. So it wasn't until I got to like LA and there was more access to different doctors that I was able to find one that worked.
Yeah. And these experiences, they are not rare. Studies show that women's pain is taken less seriously than men's. Black women in particular are more likely to have their symptoms dismissed or misattributed to weight. Just thinking about like what happened with Serena Williams. And now that I think back, I'm like, wait a minute. I actually do have an experience that lasted many, many years that I'm now just like remembering. But when I was a teenager and into my early 20s, you remember how debilitating my periods used to be. And I would literally like pass out. I would be like vomiting for days. Like I just couldn't go into work. And it was every single month. And I went through like so many different types of birth control. And I was like always being told like, oh, it's just like you just have painful periods. Like it was kind of normal. Like, yeah, it's just like you just have a bad period. And then, like now looking back into my late 30s, I'm like, just like I didn't really get a lot of testing done at that time because I was just told like, oh yeah, just get on birth control. You just have bad periods. And I'm like, I'm pretty sure I have endometriosis. And it takes years for conditions like this to be diagnosed, especially conditions that directly affect women like PCOS, endometriosis, fibroids, and it's a lot of times because providers aren't listening the first time around. It's definitely like a systemic issue. Like medical research has historically centered men. A lot of the normal ranges for lab work, they don't account for how women's bodies function over time.
Yes. Oh my gosh, that's so true. I was just watching an Instagram reel and it was this guy who said that he was having panic attacks and he ended up like going to the doctor and they like sent him for further testing or whatever. They sent him to a specialist who found out that his panic attacks were from a deviated septum because he wasn't getting enough oxygen through his nose. Oh. And then he ended up having surgery and fixing it and all of his anxiety went away. But I saw all the women in the comments were like, oh my God, like, how amazing to be a man in the medical system where you just like, you go to one doctor, they're like, let's see a specialist, because I think back to even when I had like chronic pain and chronic debilitating headaches, this is like the worst medical experience I ever had. I went to this male doctor and he's like, you know what? I don't think you have headaches. I think you're just looking for attention.
Oh my
God.
I
was mortified.
Where was that? In California?
This was at Kaiser. Yes, at Kaiser in the Bay Area. I will never go to Kaiser. I know. And mind you, like, it's just like so disgusting. And so the thing is, because my boyfriend at the time, I was like, I knew you should have came to this appointment with me. And that was another thing where I had like so many doctors. But I was like, I knew you should have came to this appointment with me because I feel like you're taken more seriously if you're even with a man.
Yeah.
I know. And my biggest regret in life is like, because I really was so shocked. I like started crying. I was like, oh my God, this is like mortifying.
Horrible. Yeah.
Horrible. I really wanted to write like the president of the hospital to tell them. And I just like, I don't know. I just like kind of felt so belittled that I didn't even take action on it. But point being is like a man goes in and says he has anxiety and he's like diagnosed with this thing immediately. And women, it's every real problem you're having. Not saying anxiety is not a real problem, but every like physical, non-mental health related problem that you're having is like always just characterized as anxiety. It's like, oh, you're fine. You're just anxious. It's stress. And it's ridiculous because so many things are missed. If you're listening and you're thinking, I've been there, because I'm sure everyone listening has been there, we just want to talk about some strategies that can help. So I think number one is trusting your gut. Your gut knows. And again, I do think that, sometimes people are hypochondriacs, right? And so I think that you have to.
I have a best friend who's a hypochondriac. It's so funny because she literally. One time it was so funny. We were in the ER because she felt she was dying. She was like, my throat is closing in on me, and she had all of us, all of our closest friends, go with her to the ER. We're by the bed with her. She's like, I'm dying. Literally telling me what she wants on her deathbed and all the things. And it turns out she was just dehydrated. And we were like, girl.
Oh no.
And I remember I had a flight to catch and she was like, you have to cancel your flight. I was like, girl.
Oh no.
I was like, girl, I'm not doing this again. She always thinks she's dying.
Oh, yeah. Does her name start with a B and end with an I?
Sure does.
Oh, poor thing. Pobrecita. Listen, I think still trust your gut, right? If something feels off, it's better safe than sorry. It's definitely better safe than sorry. However, if you know you have a history of being a hypochondriac, then, you might, that's a whole other thing. But if you're typically when you know something's wrong, really trust that. You know your body. And that's the thing that I always will tell patients too. It's you're the expert in your own body. You know what's going on. You know when things don't feel right. The second thing is document everything. And this is something that I've tried to get better at because sometimes you go in and they ask you, a lot of questions and it's a lot of details. And if you're not prepared, it's just they don't take you seriously. But I feel if you have a log of your symptoms, when it started, the dates, the tests you've done, the test results, the patterns you have noticed, bring that data to your appointments because so often I didn't. And it was just I can be a poor historian is what we would call it, where I don't know, it's kind of just, you're in a fluster. Some people I get nervous sometimes in medical settings and I just need to have everything documented.
Mm-hmm.
Right. And then also I think requesting specific tests, when you feel it's indicated. So I saw a doctor actually on Instagram say this and it really resonated with me. She was like, if they tell you that they don't want to do this test, then you can ask them, can you explain why you don't think this test is necessary? And I think that's a helpful question because maybe they have a reason, right? I'm not saying don't trust doctors. Doctors are experts and they do a lot of medical training and maybe they have, a lot of training that's telling them that they don't need this test, but maybe, I don't know, maybe that question will bring something to light.
Mm-hmm.
Also, can you document in the chart that you declined to run this test too? So that it's just there. Yeah. So they have to stand by that decision, right? It's you're saying you're having all these issues. And for me, it was please test my hormones, what's going on, and when they didn't do it, it's okay, well, you should have because that was the issue, but can you document it? I don't know what you would do with that information, but I think it just makes them, just have to feel solid in that.
Yeah, because you could sue. I mean, if it's a test that was really important and that, could have prevented, I don't know, a very life-threatening condition, then that's a lawsuit.
Yeah.
And doctors are very hesitant about, getting sued. So that would probably motivate them to do the testing.
I think also sometimes you might need that second or third, or in my case, eighth opinion. Hopefully it doesn't have to get to 8. But if your provider won't take you seriously and it's just dismissing, because sometimes too, providers just have so many patients. And if you're a little more complex, it's hard because they're I don't know, it's fine. So sometimes just switching doctors and maybe finding doctors whose appointments are 30 minutes long or even an hour. Cause I was working also with Parsley Health and their appointments are an hour and it's they can really get into the nitty gritty of what's going on in a way that in a 10-minute appointment you can't. So thinking about that too.
Yeah. Also, like just mentioned, like it could be a good idea to bring a support person. So if you just don't have that personality where you're like outspoken and you don't feel comfortable advocating for yourself in that moment, you could bring your friend, you could bring a family member, you could bring your partner, like someone who has that more assertive personality who can back you up. Patient portals are also really helpful. So a lot of these systems, they allow you to log in. You can message your doctors directly. And sometimes you can message them before your visit just so that they can kind of prepare and know what to expect with you coming in, especially if like you have more of like a complicated case. And you can also follow up and, just like put everything in writing. Like, this is what I would like tested, like this medication might not be working for me. That way it's all documented as well.
Yes.
And especially now, I think with like telehealth being really popular, a lot of doctors communicate, like you don't have to like phone them up. Like a lot of them communicate through these like EMRs. And then I was also going to say, consider a specialist. So like with Jess's condition, she really needed to see an endocrinologist and a very specific type of
My third endocrinologist, by the way. That was the third endocrinologist. Anyways.
Yeah. But it helps, like when you get someone who has a specialty, because they tend to look with a closer eye to like whatever it is that covers their specialty. And that can make a big difference too. But ultimately, like doctors are trained in medicine. You live in your body every single day. So, it's like you don't want someone dismissing your symptoms if you are sure that like something is not right, something is going on. And just remember that your lived experience matters just as much as a lab result. The goal is to like use everything together, right? So like getting your lived experience, getting those lab results, getting a professional consultation, like kind of merging all of those things to make an informed decision about what is best for you.
Yeah. I also think that providers, we really need to be very collaborative with the patient. And I feel as dietitians, like we're kind of trained on that collaborative, motivational interviewing approach where the patient is the expert in their life. But I find that sometimes like other types of providers, they're not necessarily like approaching it in that way. It's more so like top down. And I don't love that approach because it's not even considering me in the equation at all. It's just like, you need to do this. And there's so many different like doctors that I'll go to and they don't involve me in the decision-making process. Maybe there's many different medications that I could try for this thing, but you only tell me the one. And it's like, well, maybe that one, it doesn't work best for me, or maybe it's really expensive. Can we explore other options as well? And sometimes there are so many different options. So I think it's like sometimes, unfortunately, up to us as patients to kind of ask like, what is the menu of different things that I can try? And let me weigh the pros and cons of each and consider all those factors like ease of use, cost. There's so many different things. So, and like I said, if you do have a doctor who is doing that, like please tell them, or any provider, please, thank them, because I think that positive reinforcement goes a really long way and hopefully it'll rub off on, some other doctors, colleagues, things like that.
Absolutely.
So if you take away one thing from this episode, let it be this: you deserve to be heard. And if a provider dismisses you, you are not overreacting, especially if you do not have a history of being a hypochondriac. And also, if you feel like you need to push harder for answers, like it doesn't make you difficult. Because if I would have just stayed and was like, well, I'm fine, as they're saying, and they're not really looking, I literally would have been like so sick right now because they found I had like literally no estrogen. And at the time I was 38, and this probably started when I was 36, like a 36-year-old needs estrogen to function. Like, so I was low on estrogen, low on testosterone, my progesterone was off. So that would have drastically had negative impacts on my health. So keep pushing for what you need.
Yeah. And before we wrap up, we would love for you to share this episode with someone who needs to hear it. If you've had a similar experience, definitely DM us on Instagram. We would love to hear your story, and also leave us a review. You can go on iTunes under the Diabetes Digital Podcast and leave us 5 stars with some words. We read all of them. Thank you in advance. And thank you for tuning in to the Diabetes Digital Podcast. We will see you next time. Bye.
Bye.
Thanks for joining us for today's episode. If you're interested in nutrition counseling with one of our expert dietitians to help improve your prediabetes or diabetes, visit us at diabetesdigital.co.
Also, if you found our conversation helpful, do us a favor and rate and review this podcast on iTunes, plus share with someone who might find this helpful. You can also connect with us on Instagram at diabetesdigital.co.
And tune in every Wednesday for practical, inclusive, and culturally humble diabetes insights. We'll catch you later. Bye.